Rosario. I am a functional neurologist and a functional medicine doctor. And I would love to talk to you today about what I would do or look into if I had a kiddo with ADHD. And I want to start first, though, by probably answering a question that a lot of you have. What is functional medicine? What is functional neurology? So that you kind of can see the background of where I'm coming at the ADHD from, and hopefully it'll make some connections for you so that when I talk about what I would be looking for, it makes more sense. So as a functional medicine doctor, first of all, we are all kinds of doctors. We're medical doctors, internists, acupuncturists, chiropractors, naturopaths. I mean, there's many different types of functional medicine doctors. And what we do is it is a method of training that basically has us looking at the entire body as a whole, as opposed to kind of segmented parts. Like in standard medical, like modern medical field, I guess, you would normally be seeing like a gastroenterologist for any gut related stuff. You'd be seeing a neurologist for any brain related stuff. So the list can go on, right? But everybody's sort of segmented into their specialties. And the way that functional medicine works is we look at the body as a whole, because all of those systems within your body, they all communicate and are interdependent upon each other. And so our specialty is learning how they all communicate so that we can put symptoms and conditions that seem complicated and like they have a random aspect to them and make some sense of it. So it's all sort of harmonizing and coming together as one synchronous system, basically. And we look for root cause because we can determine that when we're not sectioning it all out. So we look for the root cause of where the problem is coming from, and we address that usually as naturally as possible with food and nutraceuticals and things like that, so that we can stop band-aiding symptoms. So that's basically what functional medicine is. And functional neurology is actually even less well known. It is basically where a traditional neurologist is looking a lot at structural things, like you have a tumor, or I can see seizure activity, or you've had a stroke here. We are more looking at function. So we're looking at how the different lobes of your brain are working. Are they firing too high? Are the neurons firing too low? Are the different lobes connecting and communicating the way that they should? Was there some sort of weakness in its development, or maybe it's degrading? We look at those things. So we're looking at it from a functional standpoint as opposed to a structural standpoint. And so those two specialties is what I personally meld in my own practice. And so I'm going to share with you some of my thoughts about ADHD that hopefully it'll jog some new ideas and some pathways to look for your children and perhaps for yourself, because sometimes these things pass generation to generation. So anyhow, away we go. So what I would like to say first, there are two main categories that I want to cover. It can get more detailed than this, but I think if we start here today, it's a really good starting spot. First of all, one thing I would look for if I had a kiddo with ADHD is I would look for primitive reflexes that never went away. So primitive reflexes, the one that most of us know about is the rooting reflex. When you take an infant and you brush their cheek, oftentimes their mouth will just kind of go like, and it's like they're going towards the nipple for their milk source, basically, right? So that's kind of like their cue. Milk is here. That is a natural thing. It's a reflex for them. There are several reflexes that an infant has that they outgrow generally in their first couple of years. But sometimes you do not outgrow a reflex. And the reason why that doesn't happen oftentimes is because with a reflex, it basically gets worn out and then you outgrow it. So we're going to go back to the rooting reflex. That's really common knowledge. Like how if you do the rooting reflex trigger, which is the stroking on the cheek, so many times, then basically the baby outgrows that reflex. Like the reflex doesn't work anymore. If that baby didn't get that reflex triggered, then it's going to stay. It's not going to move into like the past as it should. Okay. So some of the things that create your reflexes being triggered and therefore moving into the past as they should are things like crawling properly and tummy time and things like that. I mean, there's many of them because there are many reflexes, but those are just the ones that are most commonly known. So oftentimes if you had a kid who crawled a little wonky, like either they never crawled and they went straight to walking, or they more like scooted, or they only crawled with one leg and the other one kind of just drug behind, or they did some sort of wacky crawling. Oftentimes they're going to have a reflex that is residual all the way into, gosh, it could go into adulthood, quite honestly. There are adults walking around with primitive reflexes for sure. But the reason why I bring this up today is because in the world of ADHD, part of the symptomatology of ADHD is a lot of their frontal lobe is not developed. And that is where you do social cues, motivation, concentration, executive function, being able to like push the brakes, like, oh, that's not appropriate, like your inhibition kind of a thing. That's all your frontal lobe. So the reason why your primitive reflexes affect your frontal lobe development is your frontal lobe will not develop if your primitive reflex has not disappeared. So what I mean by that is your primitive reflexes live in the motor strip, which is right here in your brain. Okay. And when your primitive reflexes disappear because you utilize that specific reflex and it went away, then your brain development feeds forward into the frontal lobe where all of those functions that I told you about, the executive function, the inhibition, the concentration, the social stuff, all of those things live in your frontal lobe. But if you have primitive reflexes that never were worked out or triggered enough to pass into the past, then you end up not developing properly fully into your frontal lobe. That's absolutely something that is extremely common with ADHD. So just a side note for you adults, since we're kind of on the topic, so I don't need to re-explain it because it's sort of the same thing. You oftentimes cannot get rid of those primitive reflexes, and so your frontal lobe doesn't develop, but also is true if you had like head trauma or major, like in the cases of dementia and things like that, those primitive reflexes can re-emerge and cause similar issues. So that's a little bit of a side note that doesn't necessarily really, it's not really appropriate for children with ADHD, but I wanted to kind of mention it because it may be something that you can relate to, or someone in your family's past, your parents or your grandparents or something like that. If you notice that pattern, sometimes these things are genetic. And so I wanted to mention it just in the spirit of being thorough. So anyhow, that's what I had to say about primitive reflexes. It's not necessarily that easy to check them yourself. I would go to a functional neurologist, quite honestly. You can look at ACNB. That's A as in apple, C as in cat, N as in neurology, B as in board. So ACNB, B as in boy, .org. And that will have the functional neurologists that are licensed in your area. You can do a search for them. If you can possibly find one that you can get to that has a pediatric specialty, that would be even better. It may or may not say that on the site, but I would probably let your fingers do the work and give the offices a call, because pediatric functional neurologists can see absolute little tiny subtleties with the primitive reflexes that people who mostly work with adults or aren't really seeing kids day in and day out and testing those on kids would not catch the subtleties. So if you have a kid that you really need help for, it might be worth the extra step to make some phone calls and see if you can't find someone who's got a decent amount of experience, especially wonderful if they're a child pediatric specialist, but at least some experience with a good amount of primitive reflex testing so they can catch those subtleties. So that was my first thing I wanted to share. about things that you may or may not know if you have a kid with ADHD, just wanting to cover all the bases for you so you can have the information and be armed with some ideas to seek out. So the second one is, let's see. So ADHD, statistically, the children who have ADHD do not have as well of a developed right brain as their left brain. Now, in layman's like everyday terms, we kind of think of left brain people as really creative people and right brain people as, oh, I'm sorry, I messed that up. Left brain people as really like analytical people, and right brain people as really like artsy, kind of fly by the seat of their pants type of people. That isn't what we're talking about necessarily here. We're going to kind of put those aside. This is a different type of a development, okay, of the brain. And what happens is that right brain, oftentimes with ADHD, is not functioning as well as the left brain developmentally. And what that looks like is your left brain is kind of like the gas pedal. It's like go, go, go. It's your thoughts going all the time. It's your attention going all the time. It's your immune system being hyperreactive. It is everything green light, okay? The right side is like your inhibitory side. It's like the brake pedal. That is not appropriate right now. That's not appropriate for the immune system to be firing up that way right now. That's not appropriate for the anxiety, the like hyperthinking right now, like slow it down a little bit. You know, all the ways that your brain wants to just like full force forward, your right brain is the one that says that's slow it down. There's time and a place for this. I'm going to be the brake pedal when it's not appropriate. Okay. So people who have right brain deficits, aside from having ADHD, there's also a tendency towards autism, quite honestly, being somewhere on the spectrum there. There's also a tendency towards autoimmunity. If you've got that in your family, pay a special attention to this as a possibility for you, because again, if your left brain, the immune system is like, go, 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 and the right brain is not functioning as well to put the damper on it, then your immune system's going to kind of be going haywire and it can start attacking your own healthy tissues. The most common autoimmune issue is a thyroid issue, which almost every thyroid case is autoimmune in nature. Eczema, psoriasis, fibromyalgia, ulcerative colitis, rheumatoid arthritis. There are so many autoimmune diseases, it's unreal. But I would just pay attention to that if that's something that runs in your family, because some of your brain wiring will run in the family too. And so that might be something that would be something you would want to pay attention to if you do have a kiddo with ADHD or you yourself feel like you have it. So again, the right brain is not firing as well. That leads to like the thoughts not being able to put the brake on the thoughts when it's appropriate, not being able to put the brake on the actions when it's appropriate, because number one, that part of your frontal lobe may not be working well, but number two, the right side of your brain that is the brake pedal isn't working well either. So it's a double whammy, basically. Okay. The other thing that happens with the right side of your brain, if it's not functioning as well, is that right side of your brain helps to calm your fight or flight nervous system. Fight or flight's basically the survival mode, right? It's your sympathetic nervous system. Fight or flight's its name. And that is when you're constantly on edge, like trying to perceive danger. It promotes anxiety. It promotes jumpiness and irritability because of the adrenal hormones, the neurotransmitters, all the things that are pumping throughout your body. Because if your right brain isn't functioning very well, it doesn't slow that fight or flight response. And then all of a sudden, you're going to end up with, basically, you can't, there's a saying, if you are in fight or flight mode, butterflies and red flags all look the same. So if you can relate to like you're the mom that the kid jumps out from around the corner and you're screaming bloody murder and everyone thinks it's really darn funny. That's fight or flight mode. Okay. Or like you're outside and like a bee buzzes by you and you're like freaking out just instinctively, fight or flight mode. That is a really kind of common outward sign that you are that person. But it also manifests in kids with ADHD and grownups, like might be you too, with things like sleep disturbances, because the opposite of fight or flight is rest and digest. And so if you're in that fight or flight mode, you're not going to get, your digestion is going to be a little bit wonky or a lot wonky. That could lead to like constipation, bloating, things like that, because all of your gastric juices don't flow. The reason why is because your brain is sitting there saying, we're in survival mode. Like we can't digest our food for nutrients. Who cares about nutrients right now? We're trying to stay alive. That's basically the mode that your brain is getting into. And so you end up with digestive issues and you don't get that deep restorative sleep. So a lot of times, well, kids and adults that are in fight or flight either have trouble staying asleep, or when they wake up, they're really not rested. And so digestive issues and sleep issues are also really, really common. Anxiety is really common. For us older people, since we're on the topic and it's not too far astray to go, but just because if you have this wiring, it's more likely that your kids do. So I'm just trying to give you a little bit of genetic perspective in case it's helpful for you to see it in yourself. Basically, on top of those other issues, the food, the digestion, the sleep, you can also have more inflammation in your body because of the stress hormones running through your body. They're inflammatory. And that can, in your actual like head down body, can lead to like aches and pains, like joint pain and muscle aches and things like that. Inflammation is notorious for doing that. You also can have inflammation in your brain, which will lead to like brain fog, lack of concentration, just memory issues, trouble finding words, things like that. Those stress hormones really especially take its toll on your memory. And that can be something that's absolutely happening for your kids too. If that right brain is down, it's not calming the fight or flight system. So all those stress hormones of being in constant survival mode are pumping through your body. It's making your brain inflamed, your body inflamed, etc. So side note, it also has an effect on your heart rate, making your heart rate go high, your blood pressure. Sometimes people have like urinary dysfunction, like where they have to pee all the time, or they have sexual dysfunction. Those are all of them, some of the joyful, fun things that can go along with being in fight or flight mode. And ultimately, that often comes from your right side of your brain not functioning as well as the left. So how you would want to remedy that sort of depends on how it's presenting. So I do encourage you to get an actual functional neurologist if you've got a complicated kid, for sure. But you can check for things like, do they throw the ball, pick up the pencil, kick the ball all with the same side? That always should be the case. If they're switching sides, there's a connection issue between the two brains. Symptom wise, you can just kind of go back over what I was talking about with the right brain being down and know that that can be problematic, I guess, for like you can identify the symptoms that may be coming across for you or your children that fit with that right brain down that I just kind of went into for the last like 10 minutes or so. I will include with this lesson a PDF of some of the frontal lobe signs and symptoms so that you can kind of check through that list and see if that might be something to look into. So for instance, with that list of frontal lobe symptoms, you can go through, and if that's really checked off pretty strongly, you really may want to consider looking into the primitive reflexes. Okay, I'll also include a checklist for being stuck in fight or flight. And if that is the case, you will likely want to work on the right brain with some exercises. I'll include some of that as well. And also, you know, if you're a parent and you're seeing being stuck in fight or flight yourself, you're really going to want to get yourself out of it, maybe even before you try to work directly with your children, because when you're stuck in fight or flight, your own wiring, therefore your own reaction, even down to like tonal stuff, gets affected. And it's like, so it's subconscious stuff. You're probably not even going to know. It's like your facial features or your expressions. It's the tone in your voice and things like that. Those things can settle for you by working on your own system to calm your own fight or flight system. If that rings true for you and you think that might be part of your wiring, I will also in the PDF include some resources on how you can perhaps address that yourself. But in the meantime, I would probably work on yourself with a fight or flight system, and then maybe some right brain exercises with your kids that have ADHD, and maybe getting them assessed for those primitive reflexes. So in summary, I just will say, check the primitive reflexes, especially if there's frontal lobe symptoms. And if you have a lot of autoimmunity in your family, that's a big clue. If you have a lot of anxiety or kind of ADHD type symptoms in your family, those are all clues of the right brain maybe not functioning as well, perhaps genetically, perhaps developmentally. So those are kind of some pathways, I guess, to look for in your kids and see if you can't gently nurse them. There are some things that I'll suggest that seem kind of weird. Like there's music that your right brain really loves, and there's music that your left brain really loves. So I'm going to just include some ideas that some of them might seem odd, because functional neurology is a little odd. We pretty much exercise those areas of the brain in some strange different ways, but it's really effective. And you can even have some stuff on in the background or be doing things kind of subtly that your family might not even realize what you're doing, to see if you can start to notice a difference. So anyhow, I hope this is helpful for you. In the PDF, I'll include how you can find more information. I tend to work with women in exiting fight or flight. I don't mean to exclude the men, but in world experiences and life experiences and roles that we play, women tend to have a different way out of the fight or flight system than men do. And so I specifically work with women because I know that best, and that's the patient load that I have mostly had the experience of working with to help them through this. So that's mostly who I work with. I'm happy to work with you as the moms, the motherly figures in the kid's life, to see if you can't help yourself so that you can help your children who might be struggling a bit with the ADHD symptoms, and definitely some ideas on how to directly help them as well. So it was really nice to chat with you all today, and I look forward to the Q&A. So check out the PDF, and I will be talking with you relatively soon. Thank you. Bye-bye.